I would now like to introduce Candice Coghlan, who will be joining us. There she is. And she will, of course, be speaking on how living organ donation gave me back my life. Candice Coghlan is the Education and Outreach Coordinator for the Center for Living Organ Donation at UHN's Ajmera Transplant Center. Candice has been working with and volunteering to support kidney patients and the renal community for 14 years. She has worked for the Kidney Foundation, the Canadian Cancer Society, and the Transplant Ambassador Program, which introduced kidney donors and kidney transplant recipients to renal patients seeking guidance about different pathways to transplantation. Candice has advocated passionately for the best quality health care for patients and their families and continues to do so in her volunteer work. After receiving hemodialysis and peritoneal dialysis, Candice received a life-saving kidney transplant from her mother in 2009. In February 2021, Candice and her husband Mike were overjoyed to welcome their first child, a healthy baby girl. Transplant has brought wonderful opportunities to Candice's life, and she continues to share her journey to support others and give hope. So without further ado, I welcome Candice to this evening's event and look forward to hearing from her this evening.
Thank you so much, Jeff. I really appreciate being here tonight with everyone.
Hello, everyone. My name is Candice Coghlan. I am the Education and Outreach Coordinator for the Center for Living Organ Donation, and I'm also a kidney transplant recipient myself. I'm incredibly grateful to be asked to come and join you at the PKD Summit, and I'm going to be talking to you today a little bit about my journey and how organ donation saved my life, and then also about the Center for Living Organ Donation and some of the resources and supports that we provide to patients. I am situated in Kitchener, and the city of Kitchener is situated on the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. We recognize our responsibility to serve as stewards for the land and honor the original caretakers who came before us and who live here now. Our community is enriched by the enduring knowledge and the deep-rooted traditions of the diverse First Nations, Métis, and Inuit in Kitchener today. So a little bit about myself. I was a 24-year-old who was finishing up a 3-year degree at university, and that's me in the top left corner there. And I had many symptoms, different symptoms for the previous 10 years through high school. I had lots of colds and flus. I had skin problems. I had digestive issues. I had been losing weight, and I was really exhausted. And one of the big things that I had was large patches of dry skin on my body. And so my family doctor had thought that I had allergies. So I had been to many allergists to try to see if there was anything that could be done to these symptoms. Then finally, I came home for the summer in July of 2008. And my mom just noticed that I really was not myself and I did not look good. So she recommended that I go and get some blood work done. So I gave my family physician a call and they set it up for me to go to a clinic. And so I went and got my blood done, and that was around 2 o'clock in the afternoon. And about 12 hours later, in the middle of the night, my local hospital lab called my mother's house and told my mom to get me to the emergency right away. We rushed to the emergency. I was annoyed because I was sleeping and I was very, very tired, and I said I would go in the morning. But my mom said, when the emergency room calls, you go. So we left. I got to the hospital and they immediately had a room waiting for me. I started IV fluid and I started some blood work. I had an ultrasound done. And within a couple of hours, a nurse came in and told us that a nephrologist was going to come in and speak to us. And the nephrologist came in and told me that I was in end-stage renal failure. My creatinine was over 1200. I had under 5% kidney function, and that I would be starting dialysis within 24 hours. So that was, in all senses of the word, a crash into the renal world and what that would mean for my life. And as a 24-year-old who was used to freedom and doing what I wanted and chasing my dreams that put a complete halt on all of that. And I was admitted into the hospital where I stayed for 3 weeks. I was an inpatient and I dialyzed every day. I did hemodialysis every single day. And they were some of the darkest days of my life for sure. Trying to understand what chronic kidney disease was, what dialysis was, and trying to find how this would impact my life. And I did not like in-center hemodialysis. It didn't work well for my life. I didn't like having to go to the hospital all of the time. So after about 4 months on hemodialysis, I was able to transfer to peritoneal dialysis at home. And so I dialyzed every night for 9 to 10 hours on my night cycler at home, doing peritoneal dialysis so that my days were free. And I found that really gave me a bit more freedom in my life. But of course, I was still on life support. I was still doing dialysis every single day. I still had catheters in my body, and I still wasn't totally healthy and didn't feel great. Even though dialysis made me feel better than when I was walking around without it, I still didn't have that life that I had wanted. So throughout that time, my mom decided that she wanted to get worked up to be my donor. And so she went through that process, and we found out in the summer of 2009 that my mom was going to donate a kidney to me on September 9th, 2009 at 9 a.m. So 9 is now our favorite number. We both went through the surgery and it was an incredible success. She donated her right kidney to me. So she has a larger incision than most do, but she's very proud of that scar. And since then, my life completely changed. My husband and I, who at the time was my boyfriend, we got married. We have purchased a home together. We were able to travel the world. And I was able to have a career and really follow my passions and do what I really wanted to do before my diagnosis. And then in February of last year, my husband and I welcomed a healthy baby girl into our lives, and she is the absolute light of our life. We didn't know that this was possible because we had been told for so long that with my kidney disease and dialysis that this most likely would not be a possibility for us, until one day I met a woman who told me, yes, you can have a family. So we welcomed our beautiful baby girl into the world. Her name is Clementine. And I just wanted to share with you some of the joy that I've been able to have since my transplant and what that transplant has meant to me. It meant absolute life. It has meant love and joy and opportunity and all of the incredible things that I have been able to accomplish and see and do these past 13 years have been, of course, in part because of my mom, who is my organ donor and saved my life. I always say my mom gave me life twice, and she gave me the opportunity to create life as well. So I am incredibly passionate about living organ donation because it saved my life. It gave me a new lease on life, and it allowed my husband and I to have the beautiful family that we do today. So I have taken that passion and brought it into my career and what I do on a day-to-day basis. So I'm the Education and Outreach Coordinator for the Center for Living Organ Donation. The Center for Living Organ Donation was created by UHN Transplant in 2018 to improve access to living organ donation for people who need a life-saving kidney or liver transplant, and those who want to give the transformative gift of life as well. We have many services. We have an info line and email support, so send us your questions. We're here to help. We do webinars every Tuesday at noon, and the last Wednesday of every month, we do a caregiver session as well. We have volunteer programs, and we do education for patients and families and the kidney community as a whole. So when we think about transplant, we think about two pathways. There's the pathway to living transplant, and there's the pathway to deceased donation. And today I'm going to talk to you about living donation. This is when a person who is alive donates either their kidney or a portion of their liver to you. It allows for many wonderful things. One of them is a shorter wait for transplant. Depending on your blood type, some people could wait 4 to 6 years for a deceased donor transplant, whereas the goal at UHN is to have living donors worked up within 3 to 6 months. So really you're looking at closer to 6 months to a year for a living transplant, which is much, much shorter than that 4 to 6 years. You can plan your surgery, so you know the date that it's going to happen. You can plan things like meals and making sure that your house is clean before you go, making sure somebody can take care of your animals, and who's going to drive you to all of those appointments. You'll have better outcomes and generally a faster recovery with living donation. And one of the biggest ones is you can avoid dialysis. So you could have a preemptive living donor transplant. Living organ donation reduces the risk of getting sicker or dying while waiting. Right now in Canada, every other day someone dies because they're waiting for an organ that has not come. It also reduces the risk of missing an opportunity for a transplant because that transplant will be scheduled. Post-transplant graft survival rates, they are absolutely fantastic for transplant. 1 year post-transplant from a deceased donor, 94% of those kidneys are still successful, whereas with living donation, 96% are still working. As you get further out, the living donor kidney transplants do last longer. So on average, a deceased donor transplant lasts about 10 to 15 years, whereas a living kidney donor lasts about 15 to 20 years. And of course, there are people who are outside that range whose kidneys last much longer and people who don't last as long as well. So I also spoke a little bit about avoiding dialysis. And we talk about preemptive transplants, which is a transplant that happens before dialysis. This is considered the gold standard of care to treat chronic kidney disease. So this is a living donor pre-dialysis transplant. Patients considered for pre-dialysis transplants, preemptive transplants, would be if their GFR was less than 15 on 2 occasions, and evidence of progression and irreversible deterioration in renal function over the previous 6 to 12 months. So if a recipient has a living donor, the referral should occur as early as possible to allow for sufficient time for evaluation. So who can be a living donor? We like to say anyone who is healthy enough to be a donor, so they don't have to be a blood relative. It can be family, it could also be friends, co-workers, community members, people from your faith community, clubs, committees, volunteer groups. And then there's also anonymous non-directed donors. So those are strangers who decide to donate their kidney or part of their liver to someone that they don't know. Why do living donors donate? Most people who donate have a connection to the recipient or a connection to transplant. But overarching with all donors who we speak to, they talk about how they want to help to do something meaningful. They appreciate their own good health, and they want to give the greatest gift of all, which is the gift of life, and to save someone through their donation. Who is eligible to be a living donor? So for kidney transplants, you must be 18 years of age. There's no upper age limit. It is based on the health of the donor. So it's really health versus a number. The donors have to have no major health issues, and they have to have compatible blood types. But if they don't have a compatible blood type, there are also other options available. And as you can see, if you have blood type O, you can normally receive a kidney from blood types O, but you can donate to all of the blood types. And this is an example where a deceased donor transplant would take much longer for somebody, let's say in the O blood donor category, because they can only receive from one blood type. And this is where, again, living donors are able to be a much faster process. If you have a donor who is eligible to donate, they just happen to not be compatible with you, you can also go into something called the kidney paired exchange program. And this is where incompatible pairs join into a kidney swap, per se. So a donor A would donate to recipient B, Donor B would donate to recipient C, donor C would donate to recipient A, and it would close a loop. And those loops could be as small as 4 or very long. Another way that those kidney swaps happen is a non-directed anonymous donor would donate into the pool, and that would start off a chain for other people. And then there would be an extra kidney at the end of that chain, and that kidney would go to an individual waiting on the transplant wait list. And if you have questions about the Kidney Paired Exchange program, you can reach out to Canadian Blood Services. They are the ones who organize this program, and there's lots of information about it. So some of the common fears that people have about living donation: I don't want to put my family member at risk. I'll just wait for a deceased donor transplant. I won't allow my adult children to donate because they have their own lives. I'm doing just fine on dialysis. I'm comfortable staying here, and I'm too old for transplant. So starting at the last one, there's no upper age limit of who can receive or donate a transplant. It's more based on your health. And so it's really great to talk to your nephrologist and your kidney team to see if this would be an option for you, because age really is just a number. And then thinking about risks to those donors. As recipients, I know myself, I was very nervous about having my mom be a donor to me. But the reason why these people step forward is because they want you to be around. They want to see you grow old. They want to have their loved ones around. And if they're able to be the person that gets to support you and help you so that you're around, they want to do that. Donors are stepping forward because they want to, and because they love you and they care about you. And the donors will go through an extensive workup process to make sure that they're healthy enough to donate. And that donor team is separate from the recipient team, and they make sure that their focus is fully on those donors. So if there is anything wrong, they will let the donor know, and they'll move on to someone else. That living donor team will make sure that the donor who steps forward wants to do this on their own volition, and that they're healthy enough to go through this process, because the safety of the donor is the most important thing to that donor team. So here's the thing that's unique, which is unfortunate as well. There's no other illness or disease where you have to find your own best treatment. And that's a heavy weight to carry. And so I want to help you think about that. How do we find our donors? We'll often hear about how difficult it is for people to ask for a transplant, that it's hard enough to ask for a ride for somewhere, let alone to ask somebody for an organ. So we tell people that you don't have to ask. Share your journey, be vulnerable, and be open about what you're going through. Tell people what you're going through. Tell people the benefits of organ donation and the differences between deceased and living organ donation, and how that could support you in your life. Share your journey with your network in whatever way you feel comfortable. So that could be with your close friends and family, or as large with media and social media. And really talk about what your why is. Why do you need a transplant? And also, why do you want a transplant? What would a transplant do for your life? Do you have friends and family who could be your advocate and who could share this on your behalf so that you don't have to? And then share the center webinars, the videos, interactive, how to find a living donor workshop. And we suggest that you connect with a peer mentor as well, because they are remarkable people to share with you what they've been through. So how do you get the message out? There are many different ways you can share. You can start with personal contacts. So your family, your friends, your community. You could send out a personal email. You could go to your community for announcements. So your faith community or your sports community, your hobby community, and send out either a post or an email or an announcement to that community. And then on a very large scale, you could look to do posts on social media, as well as traditional media like radio and newspaper or television. And then physical locations, some people have done as well. So billboards, bumper stickers, and t-shirts, but there is a cost to those. So what if you start sharing and they don't respond? We suggest that you stay positive, and people really do want to help. They just might not know how. So ask them to advocate for you on your behalf. Ask them to share your story and be a donor champion for you. Not everybody can be a living donor, but everyone can share the message. We need living donor champions. So anyone who is listening, who is supporting somebody who is in need of a transplant, please support, because starting the conversation is incredibly hard. It's emotionally draining and taxing for those of us who are in need of a transplant. And so having donor champions helps us with that emotional support, helps us share our stories and our journey, because many people don't know about living donation. So our champions can help spread that awareness to a larger network, and it takes the pressure off of us as recipients. So you've decided that you're going to share, you're going to tell your story and talk about your journey. There's a couple must-haves and a couple good-to-have things for you to go about this process. The must-have, make sure that the intended recipient is on the transplant list and that they're eligible for living organ donation. So that can be found from your nephrologist. You can let the people know who are going to support you through this journey. Make sure you know your blood type, or if you're sharing on someone else's behalf, the intended recipient's blood type. As well, make sure you have consent from anyone whose names or pictures or quotes that you're sharing. Good to have is a social media savvy person to help if you're sharing on social. Photos are fantastic. And then you can use our contact at the center to let them know that you're launching a campaign. There's 3 steps. We're going to put our story down on paper or type our story, collect information, and we're going to create our pitch. So to start, there's a couple prompts to get you started. We want you to think about who is the person who needs a transplant, if it's yourself or if it's someone you're sharing for. What are their hobbies? Who do they enjoy spending their time with? How has their life changed since their health started to decline? And what's something they're really looking forward to after their transplant? Are you part of a biking community and you want to go on a race again? Do you have grandkids that you want to travel with? Or do you want to just jump in a lake? All of those things are amazing to tell people. Here's a great example of a story. Vanessa has shared her story that she's a loving daughter, she's worked in childcare, and that she needs a transplant, a living liver donor. Now, this is great to know about Vanessa, but we don't know what blood type she is. We don't know where to contact. We don't know who to contact. And there isn't that much information about how we can make an act. So we're going to try to make that pitch a little bit better. We're going to collect some crucial information. We're going to make sure that we have the recipient's blood type, compatible blood types, and then you can also talk about the kidney paired exchange program if you'd like. The age range for donors, so for kidneys, it's 18 plus. What hospital you're listed at, the surgery details. So sometimes people like including fun things like the liver grows back or that you can live with just one healthy kidney. How do they apply? And then where can they find out more about living donation? We've updated Vanessa's pitch a little bit. At the top, we're going to say that Vanessa needs a living liver donor with blood type O positive or O negative to donate to her in Toronto. A little bit about the liver, how interesting it is. The survival rate for donors is 100%. They don't need to be blood relatives. If you're interested in applying, here's the website to complete. Vanessa's birthday, and then if you have any questions about living donation, you can contact the center. So this is a bit more of a thorough explanation, but it's also still missing a little bit of that heart that we had in the first post. So we're going to try to combine those. We're going to put those two together, and we start off by saying don't bury the lead. So state what you're looking for in the first few sentences. And once the reader has the crucial information, they can continue on to the intended story. And then include information on applications and additional resources at the end, because those who are really interested will read the entire post. This looks like a very long post, but on social media, it will cut it off at a certain point. We want to make sure that really critical information, that ask or that lead, is right at the beginning. And as you can see, at the beginning, they're letting the people know that they need a living liver donor with this blood type. They were put on the transplant list because of the disease. talking about how a healthy person can donate to save their life, and that the donor doesn't need to be a relative, just a healthy person with this blood type. And then this person goes into a little bit about how long it's going to take for them to get a deceased donor transplant, where they grew up, what their hobbies are, and what they really want to do. And then, as you can see at the end, there's the link to that health history page that donors can fill out. There's also the contact information for the Living Donor Program, and then our email if they have any more questions. And then this post also included multiple photos of the person as well, so that it would catch the eye. Once you have that great post and you're ready to go, you want to brainstorm your networks and decide where you're going to share. If you're going to share with your neighbors, your coworkers, different affiliations and faith groups, and then considering social media. Asking your family and friends to join in, letting them know that live donation is the best pathway for you, and maybe identify a family or friend or an acquaintance that could help search on your behalf to be your champion for this. If you're using social media to find a living donor, there are some pros and cons. The pros is it's an effective way to share an appeal with a very large audience. There's little or no financial cost. You can decide if you're going to add boosting your post. And then the great thing is that appeal can be shared widely by anyone who can see that on social media. And the transplant community is very active on social media, so they will share that for you as well. Some of the cons of social media is privacy. So you will be disclosing personal health information when you do that. Also, it might involve some details of your family, your work life, or other sensitive information. This is your information to share, but know that once it's made public and it's out there, there's no way to control where it will go and how it's used. So as great as it is that it's effective to share with a large group of people, make sure that once it's out there, it will be shared. So no matter where you share, please remember to be considerate of others who are involved in your journey and your story that you're posting. Respect their privacy if they don't want to be part of it. And if you take photos or recordings, get permission for anyone who is in there. And your family and friends, as well as hospital staff and other patients, have a right to privacy. So please make sure that you have everyone's consent before you post. If you receive a donation from an anonymous living donor or a deceased donor, once you've had that transplant, refrain from sharing the specific time and date of your surgery to respect the privacy of those people involved. Ontario does protect the identity of anonymous living donors as well as the identity of deceased donors. Setting yourself up for success. If you are using social media, create a new page instead of using your personal account. That way your personal account isn't bogged down with all of that information. We'd recommend you create a page on your personal account so that you can launch that campaign through a separate area. Create a new email address to manage inquiries, and then create a schedule to keep things manageable about when you're going to send things out. And of course, don't be afraid to ask for help. At the center, we're here for help, and also reaching out to your support network. So whether that's family or friends to help you. Launch your campaign, get it out there, stay positive, keep sharing, suggest other ways that people can help. Not everyone can be a living donor, like I said, but everyone can share your story and champion your cause. Things to keep in mind through this process. We don't have all of the answers as recipients. We can't give medical advice, and you cannot offer incentives. It is illegal in Canada. If you have any questions or if they have questions, you can reach out to the Centre for Living Organ Donation and we will connect with them over the phone or email. And if you don't get the response you want right away, stay positive and keep sharing. These are our education sessions that we offer at the Centre for Living Organ Donation. There's information for potential kidney donors the first Tuesday of every month. There's information about how to find a living donor the second Tuesday of every month. There's financial support information for living organ donors, because we want to make sure if somebody steps forward to be a donor that they won't have any out-of-pocket expenses. And that's the third Tuesday of every month. And then the last Wednesday of every month, we have information for caregivers. And this is for people who are supporting people who have been diagnosed with kidney or liver failure or are on the kidney or liver transplant wait list. And all of these sessions are free. They all happen from 12 to 1 p.m. virtually, and you can register for them at givelifeuhn.eventbrite.com. We have a center YouTube channel that has incredible resources and videos all about organ donation and eating healthy and staying positive and transplant innovation. We also have our African, Caribbean, and Black Organ Health channel. It has incredible conversations through our Green Table Talk show, which features many people about sickle cell, men who care, living donors, as well as living transplant recipients, what it's like to wait. All of those incredible conversations happen on this channel and much more. I want to leave you with our information. If you've gone through all of this and you're thinking, okay, I need more, you can reach out to the Living Kidney Donation Program at kidneytransplant@uhn.ca, and that will give you some information about donors and what the process looks like. Or you can reach out to us at the Center for Living Organ Donation for our education and peer support at livingorgandonation@uhn.ca. This is our information, our phone number, our email address, as well as our website, and then our social media. We're on Facebook, Twitter, Instagram, LinkedIn, and our account is at GiveLifeUHN. And then for any kind of manuals or surgery guides or other resources that you'd like to look at, you can go to uhnTransplant.ca or bit.ly/TX library, and it is full of incredible resources there for you to look at. And I'm going to leave you with one final thing, which is our new campaign that we launched at UHN, the Center for Living Organ Donation, and that is the Great Actions Leave a Mark campaign. And it features living organ donors and living organ donation recipients, both kidney and liver, across Canada. All of these amazing people who are part of this campaign. You can go to greatactions.ca and watch their stories, look at their photos, and get some inspiration. Thank you so much for inviting me today. I'm incredibly grateful to be a part of it. And I hope I sparked some curiosity in you and have answered some of your questions, but I'm happy to answer questions as well. So thank you so much.
Okay, and we're back. That was a wonderful presentation, Candice. Thank you so much for all of the information you provided. Wonderful to hear your own success story, of course, and what you've been able to accomplish already in such a short time post-transplant. So before I go in, we have a number of questions available, but let's talk just a bit about your personal experience. I mean, you've now thrown yourself in full tilt into advocating for living organ donation through your work, through your volunteerism, everything that you do. Can you summarize just what it means for you to be here with the gift of life? You've been able to see things and do things that you probably thought would be on the back burner for a long time. How were you able to get through the negative thinking when you first got your diagnosis? Like, can you walk us through a bit of that?
Sure. Yeah. So I'll start with the last question there. Definitely, it was quite a shock to me that was my diagnosis. So those 3 weeks that I was in hospital as an inpatient dialyzing every day, they were definitely some of the darkest days that I've ever had. And I completely understand some of what people are going through who are dialyzing and going through those moments of having those shocking diagnoses, because you never expect it to happen to you. But for me, what got me through was having an incredible family and friend support network, as well as a remarkable group of physicians and nurses behind me. So I'm the type of person who feels like the more information I can have, the better I can understand. And it's easier for me to wrap my head around what's going on if I know what's happening within my body. So for me, if you're like that, I would advocate that you get as much information as possible and find out what the best possible treatment could be for you. And of course, that path is different for everybody. But for me, I was told that living donation was the best possible pathway for the best success and health for my future. So right from the get-go, from diagnosis, transplant was in our minds. So our goal was to get me stable enough to actually have that workup process. And so it took a few months of me dialyzing before they felt that I was healthy enough to go through those tests. And so that was always kind of our goal, was to get me healthy enough to do that. And so I think that helps as well, is setting small attainable goals and just, working through day by day. And it's okay to have really bad days. You can't always think positive, and you can't always think that everything's going to be okay, because some days do, to be blunt, they just suck. And so allow yourself to have those crummy days too, to cry and to, maybe watch movies in your pajamas all day, but then make sure that the next day you get out of bed and shower and keep going, because setting those small goals and having those little ideas of what you would like to accomplish in a day can really help.
So it's obviously a physical detriment, and we can recognize the impact that has. From a mental health standpoint, did you feel it was beneficial to reach out to anyone? Did you include mental health professionals leading up to it? Was it something that impacted you? We hear a lot from people, obviously, as their journey is progressing and at times worsening, or they're going through a different hurdle, whether it's starting dialysis or working up for a transplant, that the mind games can obviously work against them as well. So when we, as much as we can say, keep positive, be positive, it's easier said than done. What's your takeaway from having that mental health component as support as well?
Yeah, I think that, of course, having a loving community behind you is fantastic, to have great family and friend support, but they can never know what you're actually going through unless they're a patient themselves. So I think two things. One, definitely reaching out to the foundation, reaching out to our organization, the center, reaching out to TAP. Lots of organizations out there, the Kidney Foundation, they all have remarkable peer support. And there's nothing like connecting with somebody who doesn't need to say much. They can just say, yeah, I understand. And they actually do. So that is a huge benefit. I would definitely suggest that people reach out to peer support networks all across their journey. So pre-dialysis, dialysis, transplant, post-transplant. And then one thing that also helped me a lot was to actually speak to a grief counselor. And it sounds a little strange to some people, but I was suggested by actually a peer to look into it, because we go through this process and you're trying to stay healthy and you're trying to get to that end state of that transplant. And so often we don't think about all of these changes that we go through. And then once you're transplanted, or maybe once you start dialysis, all that realization kind of sinks in. And so you grieve the life that you had prior to your diagnosis or prior to dialysis. And so grief counseling really helped me through processing those emotions that I had, that I kind of tucked away and didn't want to think about, because I was very much in survival mode of, let's get to the next hurdle, let's get past that health hurdle, and then once I'm through it, I'll be totally fine. Which of course we know that you're not just fine once you're transplanted. There's a lot of mental health issues that come along with chronic kidney disease. So definitely reaching out to peer mentors and to a therapist, a counselor, psychologist, whoever you can is very much helpful.
Amazing insight. Thank you for sharing that. I'm going to dive into some of the questions here. So
Great.
the very first one is, how old was your mom when she donated her kidney to you?
So my mom would have been in her late 40s. She would have been, so quite young. Yeah, 45 or 46 when she donated.
So that is young. Now, again, just to reiterate what you highlighted a number of times in your presentation, though age is just a number. I think that's one of the biggest myths in the organ donation transplantation world, right? Is, oh, I'm too old, they won't want anything from me, or, you know, and so on and so forth. And I think the mindset of let the doctors dictate what is salvageable or what can be donated in live donation is the best approach. You hear those success stories of octogenarians donating, you know what I mean? And again, they're healthy and they meet all of the criterion. But it's something that we hear often, that people feel that their loved ones that do want to be tested are past that point.
Yes. And I would suggest too, the best way of knowing who is eligible is to contact that donor team. So whether you're going through UHN or any other hospital, if somebody steps forward and they're interested in being your donor, my biggest suggestion is don't say no, because there is such a large donor assessment that happens physically and mentally that the donors have to go through. And so that donor team will make sure that they're healthy enough to donate. And so I always tell people, you know, don't take that gift away from them. Let them go through the process. Let them find out if they're eligible to donate, and allow the transplant team to make that decision, rather than us being afraid of our family going through this and maybe not being a donor, or we're nervous about their age. Always let the transplant team decide that.
Good insight. Okay, curious about the kidney paired exchange program. Can type O recipients ever benefit from this program? It seems like any type O donor that steps forward would always be a match for their hoped for recipient.
Yeah, so that's an interesting thought. So really, blood compatibility is just the very first step of the process. There's a lot of other things that go through in matching recipients and donors. So even if you are the same blood type, you may not be compatible and you may not be a good match for each other for one reason or another. So definitely, if you have a donor who is interested in donating, they can go through that same health history form, the same assessment. And if they are eligible to donate, but they're not a match to you, you can go into the paired exchange program. They have cross matches that happen all across the country 3 times a year. And these are very large pools of donors and recipients. And so there are lots of people in that pool who are eligible to donate and receive. And so definitely, if you have a donor, look into that, and you can ask your transplant unit about that, or you can connect with Canadian Blood Services, and they have amazing information on their website too.
Awesome. Okay, next question here. My eGFR is 20. My husband wants to be tested for a living donor. I'm not quite ready to be tested for transplantation, but can my husband start the workup process now to at least get the process started?
Yeah, so it's really up to your nephrologist when you start that process. And we always say it's kind of like the 3 bears situation, where you don't want to be too early, you don't want to be too late. It's kind of a just right situation for the recipient. But if you do have a donor who is interested, I would suggest that they contact the Living Donor Program. They fill out that health history form and let the people know who they are interested in donating to. And those people, I mean, are the Living Donor team, because it's never too early to get that health history form in. And they'll take a look at that and they'll analyze your case specifically. But definitely, it's never too early to ask those questions of your team. And especially if you have a donor who is interested, that health history form is a great place to start.
And I know you said for UHN, as an example, they try to get the workup, what was it, 3 to 6 months?
Mm-hmm.
So a lot can change over the course of that time, and that's something to be mindful of as well, right?
For sure.
Because obviously institutes don't want to go through the gamut of testing a potential donor and then something to be changed down the road. So is there a sweet spot that you would recommend, kind of that kind of blankets the right time for this? Or again, it's speaking to your nephrologist and following their lead?
Yeah, so it's kind of dependent per different people, different times. So there's not really a GFR number or a creatinine number that we say that's blanketed for everyone. But most nephrologists will start looking at looking for living donors around that 15 mark. And of course, some people can stay at that 20 or 15 for years, and other people can drop really quickly. So it all depends on your health situation. But if you have a donor who's interested and you're already at that 20% or you're at that 20% function and you've talked to your nephrologist about that, I would continue that conversation the next appointment you have and just let them know, I have a donor who's waiting. When should we fill out this health history form? Because we're both really interested in a preemptive living donor transplant, because that really is the gold standard of care for us kidney patients.
And when you're seeking a living donor and when you're putting out your story and you highlighted, the benefits of doing that and how to go about that tonight, a lot of people worry, like, how many people should they be get worked up? How does UHN handle that approach? Like, will multiple people be tested for a potential candidate? Is there a recommendation of no more than this and as many as you can start? Like, where's their stance on that?
Yeah, so generally, we don't have a number that we say to go out and look for. It's fantastic if you have too many donors, because you can, you never know what's going to happen. Generally, only about 1 in every 4 donors are accepted through the program. So it's best to have that option out there of people who are interested. And what will happen, let's say somebody who has 10 people who go online and they fill out that health history form because they want to donate to you. The Living Donor Transplant Program will look through all those forms and they'll see who they think would be the best candidate to start with, and they'll work up one donor at a time. So unfortunately, due to resources right now, we still only work up one donor at a time. But they will go through that process with the donor that they think would be the best possible candidates and the most suited for that person. And then if that person goes through the process and they find that there's something wrong, either with the donor, that there's a health problem or something like that, then they would go to the next person in line. So they would make sure that they always have those people who are interested, that they keep all of the information on file until that surgery is complete and we know the transplant's done.
Great, thank you for the clarification. One individual is asking, in your presentation, you shared an education link, I think it was a link. Are you able to recite that offhand now, because that was a pre-recorded presentation? Or
Yes. So the education link, there's 2 that you're going to want to take a look at. One of them is, and actually in the recording, it's not right. So one of them is givelifeuhn.eventbrite.ca, and I'll type it in the chat. And that one is for if anybody wants to check out our education sessions that we do every week. And then we also have webinars that go on, like monthly themed webinars. So the next one is all about Hope Air and support for living donors. And then we also have a grief webinar that's going to be happening in December as well. So lots of different information. And then the other one is bit.ly/TX library. And that one is all of those manuals and things like that you could go and take a look at. So you could actually check out what a kidney surgery is like, what the workup process is like, all of those. So I'll put those in the chat here for everyone as well.
Amazing, thank you for doing that. We have time for a couple more questions. Your insight into people that may be finding out of province donors. So if someone say in British Columbia wants to be tested for someone that is followed at your institute in Ontario. Can you speak a bit about the process of finding extra-provincial donors?
Yeah, so out of province donors are a lot easier to go through the process than out of country donors. So across the provinces, all of our centers work together. So we are actually the center that does the living liver transplants across Canada. So we have people who come from BC and out east and all over the province, or all over the country. So we have great contacts across the provinces. And basically what will happen is if you're an Ontario recipient, your donor can do a lot of their workup at their home hospital, whatever hospital is closest to them. And then they may have to fly for a couple tests, but often that testing can be done in their transplant unit in their province, because each province has fantastic resources for transplant. And then the donor will actually come to the recipient's province for the surgery. So there's also lots of resources available for out-of-province donors like Hope Air, things like that, where we can set up supports so that the donor doesn't have to pay for any of those costs. So of course, anything that the donor goes through, it's covered by OHIP, but any out-of-pocket costs, like if they want to stay in a hotel the night before transplant, or if they need to stay in a hotel the night before any assessments, any parking, meals, or flights, that's all covered by different provinces' supports. So we have one that's called Prelod, P-R-E-L-O-D. And then Hope Air is fantastic because it covers everything up front. So it will actually book the donor's flights for them, so they don't have any out-of-pocket costs. So we do have a webinar coming up on November 28th as well, all about Hope Air. So if people are out of province, they can learn about all of those resources too.
And we'll be sure to share that across our social channels as well. I know that that you're in the promotion phase for that, and that is so vital right now, obviously, with the cost of living.
Yes.
And the fees associated with everything. I know that is on people's minds when it comes to making decisions, especially one as large as this.
And we want to make sure that if a donor steps forward, that the last thing on their mind is any financial burden. Right. So we make sure that those donors, any of the costs that they incur, are covered by different resources, but that they're all covered.
Right. We have a couple comments. Thank you for sharing your story. It gives people that want to donate a lot of encouragement. Really informative. Thank you very much. So we know that your story is, of course, resonating with those on the call tonight. One last comment that an individual has typed in here doesn't speak necessarily, of course, to living donation, but the implied consent. And the conversations that are stemming around that obviously would have a massive impact in deceased donors.
Absolutely.
What is UHN's not necessarily position on that, but I guess their thoughts related to that? We know that Nova Scotia has started the dialogue, but the rest of Canada has been extremely slow in jumping on board. So does UHN have an opinion on that, or that you can speak to?
Yeah, so as the hospital, we don't really have a position per se, but as advocates for organ donation together as a whole, we want to do everything that we can that will promote better access and equity to transplant. So we have lots of conversations with our leadership teams and with our mayors and different leadership politically as well to discuss things like that. And there's a couple things that if people are interested in kind of that political side of things, one of them to check out is our Living Transplant podcast, and it's available on Apple, Spotify, Amazon, all of those places. And there's an episode that's called Two Belly Buttons and the End of the Wait List. and it's with our medical director for the Ajmera Transplant Center. And we talk about a lot of those types of political issues that are out there, you know, talking about presumed consent, talking about also, there was a conversation at one point about vouchers. So if I have a healthy donor right now who wants to step forward and donate now, could then I receive a transplant when I needed it further down the line? Or organ swaps. If a liver donor donates into a pool, can a kidney recipient receive one? So lots of those kinds of interesting conversations that we're having. And I think I'm very grateful and I'm lucky to be part of the UHN team, because there's so much innovation coming out of UHN, and we are always at the forefront of trying to push that envelope for patients and donors and families. So definitely on our minds at all times of all of those things that we can do to improve equity and access to transplant. And then also check out our YouTube channel, the Center for Living Organ Donation YouTube channel, because there are a ton of videos on there as well about other innovations too, like creating a universal blood type, which is in the works at UHN, talking about access and equity for Indigenous populations, as well as the ACB community, and then xenotransplant, which is always a really cool conversation about pig organs and how all of those hormones are being changed in pigs to potentially donate in humans with hearts and kidneys. So lots of really cool conversations happening.
Amazing. Well, I love your podcast. We obviously promote it in all of our communications and in our newsletters, and I think it's a fantastic resource. So definitely for those that are interested in learning more about the political side of things and how to get engaged from an advocacy standpoint, an absolutely wonderful resource. Okay, Candice, thank you so much for joining us tonight. It's been an absolute pleasure speaking with you.
Thank you so much for allowing me to be part of this. And thank you so much for all the thoughtful questions too. I'm really happy that I could join you all tonight. And good luck with the rest of the summit.
Great. Thank you so much. We'll be in touch.
Thank you.
Bye-bye.
Bye.